Welcome everyone to today's program. I'm Akanksha Jayanthi with Becker's Healthcare. The program will begin with the presentation, and we will have a question and answer session following completion of the presentation. You can submit any questions you have throughout the presentation by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during this time. You will receive an email within about a week following the webinar that will include instructions for how you can download a copy of the presentation. You will also receive a follow-up email shortly after completion of the program. You can submit your feedback or any additional questions at that time. This email will not include the presentation. It is now my pleasure to introduce today's presenter. Becky Carter is a 1991 graduate of Clemson University, where she earned her BSN, and a 2009 graduate of Walden University, where she earned her Master of Nursing in Informatics. Becky has been with Bon Secours St. Francis Health System for 25 years. She lives in Pendleton, South Carolina with her husband and 2 teenage sons. It is now my pleasure to turn the floor over to Becky to begin today's presentation.
Good morning or afternoon now, and thank you very much for having me. My name is Becky Carter, and I bring you greetings from Bon Secours St. Francis Hospital in Greenville, South Carolina. On our first slide is a little bit of a landscape of what Bon Secours represents. There we go. Bon Secours Health System is, we have a total of 19 acute care hospitals. You can see there on the slide that we cover the whole, pretty much the East Coast from New York to Florida. We have 5 nursing care facilities, 4 assisted living facilities. You can see there too that we have several just joint ventures. Here in South Carolina, we are in a joint venture with Roper St. Francis down on the coast. And then we do have quite a few home care and hospice facilities also spread out within Bon Secours Health System. So I come to you today from the little yellow dot there in South Carolina, and would like to talk to you about using biometrics for your patient identification. So on the next slide, we're going to talk a little bit about what were the issues and concerns that I had, specifically from the Greenville market, and then some of our issues and concerns rolled up, and we did implement an enterprise solution as far as Improvida Patient Secure goes. With Bon Secours, one thing just to let you know, we do have one EMR, so we use Epic as our vendor. And so if you're a patient in New York and you come to visit in South Carolina, we have one patient, one record. So it's one EMR that we all use the same one. So we try to do most of our contracts and services as much as possible across Bon Secours. And Improvida Patient Secure was also one of those. So I just wanted to make sure you kind of understand that. I'm going to talk to you today specifically about the issues, the concerns that I had here in Greenville, and why we really kind of pushed and voted to move forward with biometrics. So I first saw Improvida Patient Secure used at Epic's, it's called UGM, or User Group Meeting, if you're not an Epic client. They do that once a year, and they bring us all together, and we are able to share best practices, learn from each other. And then they also show us the new technology that's on the horizon. And this was one of the things I saw 2 or 3 years ago. And it really hit home with me because we do have so many of our patients that are concerned, just as probably most of you are. We're concerned about our privacy as citizens, more so now today than probably ever before. You know, being able to exchange your personal private information in open registration areas. My role here at Bon Secours St. Francis, I am the informatics nurse, but I also have a physician support team, as well as the medical records department reports to me. So that second bullet of duplicate records and overlays, patients don't always come in with that great federally issued ID, driver's license, something with a picture on it. And so what we found happening was the registration staff just created a new record because they couldn't identify necessarily who the patient was. Of course, there's always human errors are being made. You don't spell the name right, you don't search for it just exactly right. We had several issues of identity theft. In 1 year, we, I think, had 13 identity thefts here just in my market. And just the ever-growing concerns of safety in our community, and then the increasing number of security breaches, not necessarily in our hospital or even in healthcare at the time, but we had in South Carolina a Target breach. The Target, the superstore had a breach. Our own state of South Carolina at the government level had a breach. So issues were growing and were quite alarming. On the next slide, what did I see as an end user or a customer? What was I looking for? One, first and most important for all of us in healthcare is to improve patient safety. You know, I try to think of all of our patients as my own family, my mother, my husband, whomever laying in that bed. And we want to do everything we can to keep them safe, which means I need to keep their medical information as intact and clean as possible. I don't need to switch Susie Q with Jane and have their allergies mixed up, because in the end that could actually be life-threatening if, you know, serious mistakes are made. We wanted to reduce duplicates. We had found here in our market alone, one of our partners was Premier, and I sat down with one of our Premier consultants and said, you know, I have this huge issue. We're spending all of this time. Can you help me just sort of, let's figure out how much money are we spending on these types of issues. So we did just that. So looking at duplicate medical records where you have a Becky Carter and a Becky Carter, and we know they are the same person, we spend the time to make sure they're the same person, and we have to merge those charts. Or an overlay happens, and that's where you have a Becky Carter chart, and maybe they pick the wrong identification, and they all of a sudden start putting Jane Carter's information in my record. Those are overlays, and what happens there? We were spending an enormous amount of time with all of our ancillary, so we had to get on a call with registration, the lab, radiology, IT, the billing, all of the departments to make sure that we pull this chart back apart correctly and that both patients' records are intact and correct. We also found with our identity theft, sometimes those are pretty easy. Other times, when people are really good at what they do and stealing, we would even know we had that until the insurance company sent a patient, or the hospital sent the patient a bill or a notice on, you know, what their balance due, and they start calling us, I haven't been there, how do I have this bill? And we start backtracking and find out that someone had stolen their identity. So when we sat down and we put all of that time together and figured out, and some of it was a guesstimate of how many of each thing we had, we were close to $500,000 in my market alone of just time spent by all these employees in trying to pull back apart these mistakes. And there again, you know, why we wanted to be able to tell our patients we're doing the best we can, not only to take care of you from a health perspective, but to make sure you're secure and you can depend on us to do that for you. So like I said, I had seen Imprivata Patient Secure on the next slide at UGM with Epic, and I started talking to some of my colleagues in other Bon Secours markets, and they had also seen Patient Secure used, and so as an enterprise, we did move forward with this. Why did I like Imprivata Patient Secure over retina scanning or fingerprinting? For me, and then as we talk to our patients and other employees, the palm scanning is really the least intrusive for the patient. Here in the Deep South, people didn't particularly like too much putting their fingerprints on or scanning their fingerprints. To them, especially my hospital here is not in the best of neighborhoods, so to them that really connected to law enforcement, you know, and it just set a bad feeling with them. People didn't really like the thought of scanning their eyes for anything with retina. But we also, in talking with Imprivata Patient Secure, found out that the product is very accurate. No two palm vein patterns are the same. Even in twins, your vein pattern is very specific to you. So there's no way to steal that vein pattern. There's no way to duplicate it. It's very fast. The patient simply just slides their hand, as you see in the top right picture. They lay their hand up on the device that sits on our registration table, and it just, within a matter of seconds, will read it, and it should open then their chart. If they have a chart already in our Epic system, it will open and identify. Then the registrar just simply can continue the registration and ask the patient, has anything changed? You know, can you validate your address for me? The basic things that we need to validate have not changed, but it's not having to reproduce all of that every time. From an infection control standpoint, it is very low risk. It requires very little cleaning because the actual infrared part that is in the base of that device, so the patient's not actually touching that. It's just the top part. So our registrars just keep either some of our little, you know, the Sandy wipes like they use on the nursing department, or alcohol wipe, and just wipe that off. And so it's very easy to maintain. And our infection control nurse has been pleased with that as well. So our implementation specifics here, some of our hospitals in Virginia do use the kiosk, especially in the emergency room, which can really expedite your triage process if the patient's already been there before. We do not use that here in my market. Again, some of it has to do with our location. We replace some keyboards every now and then just because people like to steal them. I'm not sure what they're going to do with them when they get home if they don't have a computer, but that's just the nature of where we are in our market here. When my hospital first went live with Improvida Patient Secure, we actually were not on Epic's ADT system. We were on a McKesson product still. Since then, we have converted over to Epic's ADT. But with our McKesson, it was still a very easy integration. When we switched from one to the other, it was very easy as well to transition. All of that followed over into Epic. And so the workflow is simply that the patient would show up, scan their palm, and as I said, registration would continue that. We also here in my market, we do bedside registration. So we wanted to make sure that this product was something that would fit into this process. And by that I mean our chief nursing officer was very set that she wanted our patients to be as comfortable as possible, as fast as possible. If you're sick enough to be in the hospital, she didn't want you sitting around in the lobby or a waiting area waiting to be registered. So we send the patient straight to their bed, and our registration staff will go up and complete the rest of the registration process. Our Patient Secure device is very easy to do. We just have a clipboard or something, and that just lays on the patient's lap, and we're able to scan their palm and keep going. So that worked well into all of our processes and workflows that we already had in place. And how we did this, again, we did it as an enterprise rollout. We started with a kickoff at the enterprise level. We had Stephanie Zirkle-Davis as our IT analyst, and she kind of led the project from an enterprise standpoint. So each market, we did a kickoff. In my market, we did a lot of communication, which we'll talk about here in a few slides. We worked with our IT department to get our hardware ordered and set up. This device just hooks right into a USB port, so there's no, major implementation as far as IT goes. It's not a difficult setup. We worked, again, on the communication planning, which I'll talk about. Our design session was really on the rollout, how we're going to do it, what departments, are we going to go big bang, or are we going to start in certain areas? Our implementation plan, my market did not go first, so we kind of followed what had worked well in the Virginia market. There's 4 hospitals in Richmond and 4 in Hampton Roads, so they had kind of worked out the process really well by the time they got to me. as well as the testing. With the training, what we did there is Imprivata Patient Secure came on site and met with our lead staff, and they sort of became the train-the-trainer model, and then they went out and trained their staff within their individual departments. That worked really well. For us, it also works well on an ongoing basis because you have those key people that you can connect with and then, roll out any updates or anything that's coming up. And then we had our go live, which we did a lot of planning around perhaps a delay. Would it slow down our registration process? And we prepped especially our senior leaders that it might in the first few days, but it really, in all, it did not slow us down. It was in the very beginning, the slowest process is just getting them registered, which is not a difficult process. It's only a couple of steps, but it's a couple of steps that your registration staff is not necessarily doing today if you're not using such a product. But once the patient's in there, they're in there, and that next visit is even faster. So on the next slide is really talking about the technical details, and I know we have some colleagues on from Imprivata. So I am a nurse by background, not an IT person. So if you have a lot of technical questions towards the end, we'll make sure that my friends at Imprivata help us answer those. But we used 2 virtual servers. One that was our test interface, all of our testing databases, and then the other one was our production interface where we actually had our patient secure build. For us here in Bon Secours, those all reside in the Richmond area, but that's just kind of how our IT layout works for Bon Secours. The Hyperspace, the patient secure device is actually installed at each workstation. So we probably have here in Greenville, I would say 50 or more palm scanners. There's one at every registration desk, and that includes the ED, main registration, or outpatient areas. We also have these out in our physical therapy offices that are located in the community. We have about 13 now, I guess, satellite offices, and they also use them. And we hope in the near future to start rolling these into our ambulatory offices. Here in the Greenville, South Carolina market, we are still in the process of rolling out our Epic product to all of our ambulatory providers. We're almost there. Hopefully in a few months we'll be 100%, and then we will hopefully be able to push Imprivata Patient Secure to all of those because many of their patients are shared with the hospital. So the thought process there again is speed up your registration in the doctor's office as well. On our next slide is a little bit more just about training. I touched on this earlier, but we did identify super users for each department. For our registration staff, it was mainly they decided to choose their supervisors and team leads, and they were trained here on site. Imprivata came to us and provided close to an 8-hour day, maybe a 6-hour day of training, but it was really very detailed on how to use it, how to troubleshoot if the scan doesn't read, how a lot of it is communication to the patient on how to place their hand. It's not difficult, but we all know there's some individuals that might need a little extra help. So a lot of it is how do you explain this to your patient and that it's safe and that we're here to use it to offer more security. And then our super users now, you can leave it on that slide, I'm going right to communication. I wanted just to add that and what should be happening is as you onboard new employees, while you're teaching them how to use the EMR, Imprivata Patient Secure device is just part of that and should be the ongoing process for a new hire training as well. So communication, as we all know in healthcare, is key, whether we're teaching someone how to do something up on the floor or you're teaching a patient to go home. Communication is key with a product such as this as well. We chose to do a couple of things. The pictures you see there are actually just copies or pictures of the materials that we use here. So we have one, the picture on the left, the patient educational brochure, is actually something we can hand to the patient. If they are not sure, it's not a mandatory registration. We do not force them to do it. If they're not sure, then we give them the educational brochure, explain it to them, and say, perhaps the next time you come, you'll feel better about it and you'll be able to do this with us. Or if the patient does not have identification with them that day, to our policy here at Bon Secours is you must have a picture identification with you to register. Because again, back to my very first points of why do we even do this, if you register the wrong person and now you tie a vein pattern to it, you really defeated all the purpose there. So our policy is they must have picture ID to register. So if they don't show up with that, then we give them the brochure and explain next time, please bring it. And that we've not really had any problems with that so far. The document to the right, we actually laminated these, and we have one at each workstation. So as the patient sits down, they can see a diagram, basically, of what we need them to do as the registration staff is explaining it to them. And that's worked well as well. On the next slide, one of the other things my marketing department decided to do, not necessarily at my request. If we go to the next slide. There we go. Here in Greenville, my marketing department surprised me one day and said, hey, our local news station is here and would like to talk to you about our new devices and registration. So we ended up, after probably a month and a half, I think I talked to all but one news station in our local area. We also put articles in our local magazines. We made the front page of the paper the day after the Super Bowl. So I had the Super Bowl on one side of the page, and my little article was right beside the picture. So it was quite interesting. One of the, I believe it was Fox, the one on the left, we actually, their sister stations across the country picked up that story. And so Improvida Patient Secure was getting calls or hearing about from other clients that they saw, the TV broadcast. And so it was kind of a surprise for all of us. But we did this because we wanted our patients to understand ahead of time why we were doing this, what's the importance of it, and that we were doing it for their safety, and not to, we're trying to enhance their privacy, not hurt it any. And that went over pretty well in our community. So on the next slide, these results are really very close to a year old, but then we had 264,570 patients have been enrolled across Bon Secours. I believe that's across Bon Secours, not just Greenville. But we've had right at a 99% acceptance rate. Once this is explained to the patient, I think just the days and times that we live in now in this country and around the world, people are very apt to participating, because if one more way to help protect me, then let's do it. It has reduced our duplicate medical records. I'm not going to say it's completely wiped them out, because as with any product you use, I don't care what vendor it is, you always have a human element. So you have those employees who are going to take their shortcuts, or you're going to have, issues come up. But it's completely, any issues I've had has been employee human related, not software related. And we just have to go back and educate and re-educate that you don't take the shortcuts. But we have seen a lot less of our duplicates. We have seen a lot less of our identity thefts. And our patients have been very satisfied, again, with the device. Once it's explained, they've really not pushed back on that. On the next slide, I think we talked specifically about identity theft and fraud. For me, this was one of the biggest reasons why I was very interested in this product, is because we were having so many folks coming in and using others' insurance information or their identity, most of the time it's because they wanted to use their loved one's insurance. We had one daughter, as mentioned there, used her mom's insurance card, and the mom came in to get registered, and she told us she suspected her daughter of doing that. We had a patient who had sort of hospital hopped. He had been to 3 upstate hospitals here in the area, and every time he would go to the hospital, he would use a different name or a different version of his name. And so I was able to use patient secure device sort of in a way of saying, you know, I need to scan your palm and we need to identify you. And even though I'd never used that, it worked well because he started confessing exactly who he was. Not necessarily what you mean to use the device for, but I'm just saying if you get into that situation and you have people doing weird things, you can use it to your advantage. But we have caught sisters who actually, one had insurance, the other did not, and they were actually at our east side facility. One was delivering a baby. So she was trying to use her sister's insurance for the childbirth expenses. We've found several others. And then we've caught people who just come in, and while they're still upstairs in the bed, we're able to find it. So we haven't eliminated identity theft because unless you have some great FBI in your back pocket, I'm not sure you could do that. But we are able to catch them on the front end now. We're able to catch them while they're still in the building, perhaps, in the bed. And so we've not had any that I know of, knock on wood, in the last 11 to 12 months that have been where the insurance company or the patient calls saying I received a bill. So that, to me, is a much better thing to have happen. Nobody wants to get a bill for services they never received. We don't like to get the bill, period, when we did receive them, but we certainly don't want to get it if it wasn't ours. Another benefit on the next slide is really to enhance the patient experience. As I said, we did provide education to all of our registration staff so that they could communicate safely the benefits to the patient, the safety of the device, and that it was not going to hurt. The infrared light is not going to hurt them. It's all, very low lighting, and it's not dangerous to them. Patients have really appreciated the security and privacy protection that this has provided them, and some of it just goes that we're putting forth a great effort to try to protect them. You know, so many places are not offering anything, and so our country feels exposed a lot of times. So many were just very glad that we were attempting to try to help them, and that it was easy to use. They also like the fact that once they're registered, they don't have to repeatedly show their ID. We are also getting ready to, some of our markets have already added pictures, but our market has not. We're getting ready to do that hopefully shortly, so that when I scan my palm and my chart opens, another identifier will be my picture right there inside the chart. So, what more perfect scenario could you have to speed up the process, have a picture that matches the person in front of you, and you're able to keep going and start your registration or the care of the patient. Really expediting the registration process has already happened if people use the product correctly. So it really could expedite patient care because you're able to get to why they're here much faster. Some of our lessons learned, training, as with anything, is critical. End users must be trained not only how to use the system, but again, as I mentioned a little earlier in the presentation, they have to be trained on how to explain it to the patient. If they just hand them something and say, put your hand on here, then the patients are going to look at you kind of strange. The hand placement, while it's not hard, it's important to have it on the device correctly to get a high-quality scan for enrollment. We want to get it right the first time. Utilizing those communication tools that I told you about, whether it's the handout, whether you do some community communication, and also using the devices there beside, or the communication tool beside the device is very helpful. And then technology issues, really, knock on wood, we've very seldom have I ever had a problem with the technology side of Imprivata Patient Secure. Just like anything, you may have upgrades. We know ahead of time when those are going to happen, but as far as a downtime or for some reason the device doesn't work, that I can't even think of a time in the recent time that that's not happened, or that has happened. Very, very seldom has there been an issue with the technology of the device. So our future plans within Bon Secours, as I mentioned way early in the beginning, some of our Virginia hospitals already have kiosks in their emergency room. I would love to do that here in Greenville, especially in some of the outpatient areas where you're doing very fast turnover, very fast registration of those patients. You have high volume. The kiosk would be a great way to expedite that process. And I've already mentioned as well, rolling it out to some of our ambulatory offices once they're all live and we're all on the same instance of the same EMR. I think that would expedite theirs. And then as well, if a new patient comes and perhaps their first encounter with Bon Secours is in the ambulatory office, and then they send them to the hospital for some services, again, they're already there and it will expedite. And I think our patients will see that as a way that we're all working together to expedite their care. And then with the new management console, there are lots of reports. We just got an upgrade with that actually a couple of weeks ago, so I'm still learning some of that new stuff. But there are all types of reports that you can run with Imprivata Patient Secure. You're able to tell exactly how many scans you have done. You're able to tell which employees actually did the scan. So I've done that a few times. I'm not over the registration department, but I can see the report. So I like to go in and see, you know, who's using it, who's not, and then I can work closely with the supervisors of those areas to say, you know, I see Miss Smith here. She doesn't seem to use Patient Secure very often. She's not enrolling anybody. What's up with that? And maybe it's that her role in the department is not one that she needs to use it. She may be in the back. That's all well and good, and but we're able to see it, and so you're able to tell who's using it and how often. And then always, you know, providing retraining sessions. We're in the process of actually doing that here in Greenville. We're going to be working with Stephanie, our IT analyst, and some of our friends at Imprivata to just do a refresher. Maybe none of you have turnover in your hospitals or facilities, but anytime you have turnover, and we here in Greenville have had a good bit in our registration department specific to the emergency room. So we need to go back and make sure that, one, they're using it correctly, that the training's been correct, and it's just good to go back and refresh and make sure that those humans are not cutting the corners where that you don't want them to, because again, you want them to use what you're paying for the right reasons. So always provide retraining, and we're no different. After a couple of years, we're still going back to do that. So that's how we're using Imprivata Patient Secure here in Greenville, South Carolina with Bon Secours. And I will open it back up to our friends, or maybe I'm sending it over to Imprivata.
Great. Thank you so much, Becky, for that fantastic overview of how you guys are really improving patient safety and reducing duplicate medical records. For anyone that has questions for Becky or myself here at Imprivata, please go ahead and start entering those into the questions area. And we're just going to do a quick 5-minute overview of the solution, and then we're going to go ahead straight to Q&A for the rest of the session today. So before we just tell you a little bit more about Patient Secure, I want to give everyone on the line an overview of Imprivata and who we are if you're not familiar with us. We're a healthcare IT security company that has been around for over 12 years, and our entire mission in healthcare is to really enable both patients and care providers to be able to act conveniently and securely. And what we mean by that is we make it very easy for them to identify patients, and that's with the Patient Secure solution. We also make it easy for them to access the EHR through a single sign-on and authentication management solution. We enable them to communicate easily through our secure texting, secure messaging products. And we also enable them to do secure transactions with two-factor authentication for things like controlled substances. So that's really where we play. And most importantly, we are first and foremost a security company, making sure that we're keeping all that PHI always secure and encrypted. And really some of what Becky talked about today is what we're hearing from many hospitals around the country, in that 7 to 10% of patients are usually misidentified when their medical record is accessed. And that number is definitely on the rise as healthcare is consolidating and organizations are acquiring more hospitals and duplicate records are increasing. And what we're really seeing is that, hospitals are struggling with duplicate records, as you heard Becky talk about, medical overlays, which are extremely dangerous for adverse events for patients if you are intermingling someone else's PHI with another's, as well as identity theft is on the rise in general. And there aren't really great processes in place or technologies in place to prevent someone from being able to steal someone's identity and then use that identity when entering the hospital. And of course, that can end up in patient harm, loss of revenue, as well as patient dissatisfaction for many organizations. So as Becky mentioned and gave a phenomenal overview of the Patient Secure solution, we leverage palm vein technology to be able to positively identify patients. So when the patient comes in to the ED or into registration, they simply scan their hand on that reader. That is scanning the palm of their hand. It's not a palm print, so it doesn't have the same connotations like a fingerprint. You can't leave your palm print or palm vein at the hands of a scene of a crime, but it is very accurate and immediately brings up the patient's record once they've arrived. So very secure, but also very accurate as well. And today, Patient Secure is in over 350 hospitals across the U.S., which spans 65 health systems. And we also have organizations that are expanding it to their clinics to be able to provide that experience outside of just the acute care hospital. And we're deeply integrated with both Epic, Cerner, McKesson, or major EMR platforms that you may have for registration, so that when that patient comes in and puts their hand down or their palm down, their record is immediately brought up. And lastly, Becky mentioned this as well, we do work over multiple systems, so that if you have a health system that has 5 or 6 different locations or organizations, and they could even have disparate EMR or registration systems, Patient Secure can be the link to identify patients across those. And just another proof point, Becky talked a lot about duplicate medical record reduction. Here's just another proof point from another customer in Carolina's healthcare system. And they started with their journey upon trying to reduce duplicate medical records from about 10% to 7%. Then they implemented their EMPI solution and got down to about a 5%, but they were still continuing to acquire hospitals and always had manual registration happen. And it wasn't until they added biometrics to their EMPI solution and on top of those workflows that they were able to reduce it down to a 0.01 is where they are today. And we are very excited to be, really helping hospitals solve these problems and improve patient care. And I see there's a flurry of questions coming in, so we're going to go ahead and start answering those.
Yeah, thank you to all of our panelists for a very informative and enjoyable presentation. We will now begin the question and answer portion of the program. As a reminder, you can submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have for Q&A. All right, so our first question is, how does the palm scanner work for children, especially neonates? Does the vein pattern stay the same throughout lifespan?
Sure, I'll take that one from Imprivata, and then if Becky wants to add anything, she can. So so your palm vein does stay the same throughout life. That's what makes it so accurate. We generally work with, children from 4 up, and that's not necessarily from an accuracy perspective. It's more because getting an infant, or 1 or 2 year-olds to try to put their hand on something and keep it there for, a brief moment can be challenging. So generally we recommend 4 and up for the solution. And while that palm vein will definitely stay with them for life, we always recommend that, folks do re-enroll them every few years. But it absolutely can be used for children, pediatric, we have children's hospitals that are deploying this as well.
Wonderful, thanks. All right, our next question. Oh. Go ahead.
No, I'm sorry, this is Becky. I was just going to add on to that. We did work that into our, we wrote a policy, and so we specify the age and the children issue into that policy so they know. So thank you.
Okay, great. Our next question is, did you clean up your Enterprise Master Patient Index prior to implementing biometrics?
This is Becky. I'll shoot at that one, and then if Justina wants to add, she can. That's a great question, and we had actually been on Epic since 2008. So we're constantly have been cleaning, since before go live. So ours was actually pretty good. We're able to run reports in Epic on that volume, and so ours was actually pretty good. But yes, we did look at that beforehand so that we knew that, since we're trying to prevent that. So that's an excellent question.
Wonderful, thank you. Our next question is, if a patient arrives in the emergency department unconscious, do you scan their palm?
And that's a great question. Is actually one of the great reasons to actually use and provide a patient score. As long as the patient has blood flow, so they have to, they have to still be alive. They can't be a DOA. They have to have blood circulating through their body. But if it is, then yes, you could scan their palm, and if they have been registered, it should open their chart, yes.
Okay, wonderful. And our next question is, how did you sell this to senior leadership? Do you have a return on investment for the cost of investment?
For me, just using my Premier numbers and showing them how much we were spending, without it, was a pretty easy sell for me. They've not really challenged it since then. And we have been able to cut down, like I said, our identity thefts have gone from 13 a year to, I think we may have had 1 in the last 13 months. And our duplicates have drastically cut down, but while we still have them, like I said, it's because the ED nurse just creates a chart in a hurry and it forgets the process.
Mm-hmm. Okay, great. Our next question is, how do you address issues when a patient absolutely refuses to accept palm scanning? And there's a second part of that question, which is, do you anticipate requiring palm scanning for all patients?
Here in Greenville, it's not a mandatory. So if they say no, they don't want to do it, our process is just to give them the brochure, explain the benefits, and say perhaps next time, they would like to. But we don't force anyone to do that. That's just part of that is our culture in Bon Secours, and we would not force them to.
Mm-hmm. Okay, wonderful. And another question coming in, it says, it seems like this is a great solution moving forward, but did it take a while to clean up the past data and any previous record mismatches?
It does take a little while. Like I said, we had been working on getting that cleaned up for a while, just because we had to start doing that when we went on our EMR, and we try to keep up with that on a monthly basis. I mean, some days we're doing it daily if something's happened over the weekend, but it really just depends on how many you have and what's the manpower you have to clean it up. I mean, I'm sure anybody that's in the HIM department on the line understands that. I mean, some of our markets have a lot more staff than I have here in Greenville, so it depends on the manpower and how long it would actually take.
Mm-hmm. Okay. And have you installed the process also in physicians' offices?
Here in Greenville, we have not yet, but we are hoping to roll that out soon. But it can be just as easy. For us, it's the same EMR, so it's just a matter of deploying it and doing the education. That is my plan.
Wonderful. All right, and so what other hospitals are using this system, and what are the benefits that they have seen?
Yeah, sure. So I can take that one. I know, Carolinas Healthcare is a big one that we mentioned earlier. If you're more, towards the West Coast, organizations like Sharp, Baton Rouge Medical. We have a number of organizations, as we mentioned earlier, over 150 hospitals specifically that are using this, and we'd be happy to, provide any additional references as needed for folks if they'd like to reach out.
Okay, wonderful. Does Patient Secure work across multiple sites and EMRs?
Sure. So I think I mentioned that earlier in the slides. It absolutely does. So if you have an organization that may have Epic in one organization, Cerner in another organization, and then McKesson in another hospital that they may have just acquired, you can leverage Patient Secure to work across those so that as patients travel between those systems, they will have that one single link and one single identity.
Wonderful. Okay, and what are some deployment best practices that you all can share?
I mean, for us here in Greenville, I truly think the best practice and where it worked the best is where I had buy-in. Not necessarily the patient buy-in, but the registration buy-in. The employees have to believe in the product and why they're using it. If they see it as just an extra step, then that's what they're going to see it as. But if they see it as the actual, we're here to provide the best care possible, then they sell it to the patient. And for me, that was our best departments were where I had the best buy-in from my end users.
Okay, wonderful. Thank you. Well, I want to, again, thank our presenters for their excellent presentation and for all of you for participating today. We look forward to having you join us for future webinars. This concludes today's program. Have a wonderful afternoon.